Welcome to our channel. In today's video, we will be discussing the challenges and treatment options for women with blocked fallopian tubes. Blocked fallopian tubes can be a significant cause of infertility, making it challenging for women to conceive. However, there are several treatment options available, including in vitro fertilization, IVF, and tubal surgery. Let's get started. Understanding blocked fallopian tubes, causes, diagnosis, and treatment. Blocked fallopian tubes are a common cause of infertility in women. The fallopian tubes carry eggs from the ovaries to the uterus for fertilization. When they are blocked, the egg cannot reach the uterus, making it difficult to become pregnant. Blocked fallopian tubes can be caused by pelvic inflammatory disease, endometriosis, previous surgeries, or other factors. Diagnosis of blocked fallopian tubes can be done through a hysterosalpingogram, HSG, or laparoscopy. Treatment options may include surgery, fertility medications, or in vitro fertilization, IVF. Women should work closely with their doctor to determine the best course of treatment for their individual situation. Recognizing the symptoms of blocked fallopian tubes. Blocked fallopian tubes can cause a range of symptoms that can affect a woman's fertility and overall health. The most common symptom of blocked fallopian tubes is infertility. When the tubes are blocked, the egg cannot reach the uterus, making it difficult to become pregnant. Women with blocked fallopian tubes may also experience pain or discomfort during menstruation or intercourse, as well as an increased risk of ectopic pregnancy, which is when a fertilized egg implants outside of the uterus. In addition to infertility and pain, other symptoms of blocked fallopian tubes may include heavy or irregular periods, pelvic pain, and painful intercourse. Some women may also experience pain in the lower abdomen or during bowel movements. Uncovering the causes of blocked fallopian tubes. Blocked fallopian tubes can be caused by a variety of factors, including pelvic inflammatory disease, PID, endometriosis, previous surgeries, congenital abnormalities, scar tissue from previous infections or surgeries, ectopic pregnancy, and other factors. Diagnosing blocked fallopian tubes. Diagnosing blocked fallopian tubes is essential to determine the best course of treatment and increase the chances of becoming pregnant. There are several methods for diagnosing blocked fallopian tubes, including hysterosalpingogram, HSG, laparoscopy, and ultrasound. A proper diagnosis is necessary to determine the best course of treatment and increase the chances of becoming pregnant. The basics of in vitro fertilization, IVF, for pregnancy. In vitro fertilization, IVF, is a popular and effective method for couples who are struggling to become pregnant due to infertility or other reasons. IVF involves fertilizing an egg outside the body and then transferring it back into the uterus. IVF is often successful in helping women with blocked fallopian tubes become pregnant. However, there is no guarantee of success with any treatment, and multiple rounds of treatment may be necessary. Risks and complications of IVF. While IVF is generally considered safe and effective, it does carry some risks and potential complications. These can include ovarian hyperstimulation syndrome, OHSS. This occurs when the ovaries become swollen and painful due to the high doses of hormones used to stimulate the growth of multiple eggs. In severe cases, OHSS can lead to blood clots, kidney failure, and other serious complications. Multiple pregnancies. IVF can increase the likelihood of multiple pregnancies, which carry a higher risk of complications such as premature birth, low birth weight, and developmental delays. Ectopic pregnancy. This occurs when the fertilized egg implants outside of the uterus, typically in the fallopian tube. Ectopic pregnancies can be life-threatening if not detected and treated promptly. Birth defects. While the risk of birth defects with IVF is generally low, some studies have suggested a slightly higher risk compared to natural conception. Emotional and financial stress. IVF can be a physically and emotionally demanding process, and the financial costs can be significant. Patients may experience stress, anxiety, and depression during and after treatment. Success rates of IVF. IVF success rates can vary depending on a range of factors, including the age of the woman, the cause of infertility, and the number and quality of embryos transferred. On average, the success rate for a single IVF cycle is around 30%, although this can be higher or lower depending on individual circumstances. In general, younger women tend to have higher success rates than older women, as the quality of eggs declines with age. Women under 35 have an average success rate of around 40%, while women over 40 have a success rate of around 10 to 15%. Conclusion: in vitro fertilization, IVF, is a valuable option for couples struggling with infertility. While it can be a complex and demanding process, IVF has helped millions of people around the world to conceive and build their families. However, it is important to be aware of the potential risks and complications associated with IVF, as well as the emotional and financial stress that can come with the process. Couples considering IVF should speak with their doctor or a fertility specialist to determine if it is the right choice for them. Thank you for watching. Like, comment, and subscribe.